Good evening. My name is Jessica Brinkley, and I'm a Senior Program Policy Specialist with the National Education Association's ESP Quality Department. I, along with my colleague, Tim Barczyk, who is also a Senior Program Policy Specialist in the ESP Quality Department, will be serving as your moderators for this evening's informational webinar. So we welcome you to the Using Advocacy to Address Contemporary Issues Facing ESPs. This presentation is brought to you by the NEA ESP Quality Department, housed in NEA's Center for Professional Excellence in Student Learning. The ESP Quality Department represents and advocates for over 400,000 NEA education support professional members, also referred to as ESP. ESPs serve as fellow educators in the school community and play an important role in supporting the whole student. Our strategic focus is to elevate ESP careers by developing, implementing, and promoting best practices, policies, and professional supports that equip ESP with the knowledge and skills to become empowered leaders, accomplished professionals, and members of a high-quality workforce prepared to meet the needs of the whole student. At this time, I would like to pass it on to my colleague, Tim Barczyk, who will introduce our panelists for tonight.
All right. Thank you, Jessica. So I'm really pleased tonight to have our advocacy specialist, also known as UniServ, actually from around the nation tonight. And so we have Sheila Washington from Louisiana, the Pelican State, Nicole Argraves from New Hampshire, the Granite State, Ken Valente from Oregon, the Beaver State, and from the Show Me State of Missouri, Graylin Brown. So we will start going through questions with these advocacy experts, and we'll just get this show on the road. So first question, as UniServ, are you still dealing with safety concerns for our ESP? This, of course, is directly pertaining to COVID. Is that still an issue out there in your advocacy work? Let's start with Sheila Washington from Louisiana on this question.
Greetings. It's not as bad as it has been, but it's not as good as it could be. What we're dealing with partly is now, and if you've seen any national news, you have seen Louisiana in the fight with parents regarding the wearing of masks. Our governor has lifted it in some places. However, we have parents that have gone toward the other end. I won't call it deep, but they went off on the other end. And they're not realizing that they are putting our staff in harm's way. So we are still dealing with the safety concerns. However, the custodial staff at all of our districts and around the state have been trained and have been very proactive in sanitizing, wiping down, and keeping things safe for our staff and students.
Thank you, Sheila. Let's jump clear out to Oregon, to Ken Valente. Ken, are health and safety concerns around COVID still an advocacy issue that you're dealing with?
Yeah, hello everybody. Thank you. My name is Ken Valente from Oregon, Albany, Oregon specifically, which is the unceded lands of the Kalapuya tribe. I have been working on a lot of health and safety issues. I'm not going to go too deeply into them. I'd rather just kind of identify what I've seen happen. I think that ESP workers have been in many situations which can be the most direct contact with the public, with students, and that was from when the pandemic first began, starting with food service workers. There's also been extra duties, responsibilities, and stress around keeping things clean and sanitization. There's also the health and safety issues that have arisen around how vaccinated and unvaccinated issues are working out from state to state, whether folks, how they're able to access work or not work based on their status. So that has created kind of internal issues and also the ability to work be paid, have access to work. So those are the main things I'm seeing. And I'm actually very happy on this Saturday, we have our Oregon Council for Education Support Professionals Conference, which is dedicated to professional development for ESPs. And I'll actually be heading the health and safety Q&A and kick that around. So I'd actually probably have a little bit deeper insight with that statewide discussion. But I found that ESP workers, you know, they say the front line from the beginning. There's been the issue of folks saying, when are schools going to open, or have they open? When we know ESP workers and teachers as well, but ESP workers have been in direct contact and have had to navigate that system in general. Yeah, that's what I've seen. Thank you so much.
Great, thanks, Ken. Nicole Argraves from New Hampshire, still dealing with health and safety issues for ESP?
Hi, Tim. Yes, we are dealing with health and safety in New Hampshire as well. As you've heard from the other panelists, you know, it's much different than it started, but it's still an issue. We in New Hampshire did memorandums of agreement to deal with health and safety issues for both professional and support staff from the very beginning, and have done them for all our locals starting in 2019 in each of the school years. I will say that the health and safety agreements that we're doing now are less intense. They're more global about issues we're addressing. But as everyone on the panel has already said, the support staff we have are the ones that have been most at risk. They're the ones that have had to come in when other folks were able to be remote. They're the ones that are, in most cases, unable to keep social distancing because the student population that they work with really require the support and the direct contact that doesn't allow for, you know, 3-6 foot or greater distancing to really support and service the students that they're working with. And during periods of closure due to COVID, those support staff still had to work with the most needy students. It was required here in New Hampshire. I'm sure it was in other places. And as it's been mentioned, the custodial staff as well, right on the front lines in terms of cleaning and being the most exposed to potential contaminants from COVID. Food service workers, same thing. I think along the lines of what Ken Valente mentioned, something we've seen now this last round in New Hampshire is more uncertainty with keeping the support staff working if they were to transition to remote. New Hampshire has taken the position at this point, the governor, that they're not going to support remote transition. And so most of the schools are staying in person, even when there's COVID transmissions. They're only sending pockets of people home. And so, you know, if those groups are sent home, sometimes the teachers get to work remotely in those cases. But we're really struggling to figure out what happens, you know, with the support staff in some pockets, because in the beginning, we were able to get the school districts to guarantee they were going to keep them working their work hours up and pay them in those MOUs or MOAs. By this third round in 2021-22, they're not as willing to kind of say, we're going to continue to pay you for all your working hours, regardless of whether or not, you know, we have to close due to COVID. And so that's been an ongoing question. And also an ongoing question about if you have to quarantine, you know, how are you going to get paid? Support staff are hourly. And so there aren't the same guarantees that exist for them. So that's been kind of a related risk to the health and safety concerns. Thank you.
Thank you. Graylin Brown from Missouri. Same question. And you're muted.
Good evening to everyone. Very similar to what the panelists have said. Early on in the pandemic, in my particular unit, we lost 3 support professionals to COVID because of their contact, bus drivers, food service, delivering food to the communities, so on and so forth. And it was really challenging for people wanting to work safely. And we really had to get out there and put pressure on the districts to offer protections, protective equipment to the folks doing the work. Many people were afraid to come to work, even though they were, you know, single single providers in households. So it was very, very chaotic in the initial onset of COVID. But finally, we came to an understanding and agreement through contract enforcement that, look, you need to provide all the necessary resources and adequate time and workers to properly clean, sanitize, and practice safety distances. I know one of the bigger problems, we're working with the bus drivers, where they still didn't have enough buses and they still wanted to cram students on the buses. And then that jeopardized health and safety of our drivers. So we had to have a big fight about that. We were able, as some mentioned, to keep everyone working because the food service, the bus drivers, they were delivering, again, as food to the communities. But one of the particular aspects of my unit, I service a unique local that is primarily exclusively school nurses. And we had a very big fight with the district regarding school nurses and providing the proper PPEs, because they were on the front lines. They wanted them to do temperature checks to anyone coming into the buildings, even when there were no students, when everyone was virtual. And now that folks are back, we're fighting the same kind of thing, because in the city of St. Louis proper, in St. Louis County, we have mask mandates, but in other parts of the state, we don't. So, it's basically, we're doing things as is. And if you look at the numbers on vaccination status, we're at 47, 50% in the metro area here in St. Louis, but in some of the outlying areas, it's as low as 19, 20%. So folks are in person just doing the same thing. And talking with my colleagues across the state, that, the health and safety is a big concern, because, no gloves, just go spray some stuff on the desk and wipe it off. No mask, you don't have to wear a mask. All of these kind of things are a constant fight. But coming back to the St. Louis fight, we finally got them to understand, with nurses, some of your frontline workers, we really need to have that. And it's even to the point now that we have approximately 80 FTE positions, and we're down to 46 nurses, because at the rate of pay, which is one of the highest paying nurses in the educational community, we're still at about half to what the private sector. The average RN ER nurse can make anywhere $80,000 to $100,000, on a four-day week. So we're competing against that, to the point that we just signed our contract, our 4-year contract, after 2 years of negotiating, and now they want to reopen it. And I said, we're not going to be interested in that unless you come with at least 30 grand plus, just to average out what we need to compete with our private sector. And they looked at me and said, okay, we'll talk about it, because they know they can't get nurses. Even if they hire agency nurses, they have to pay them an exorbitant fee, and they only stay for a few weeks because they can't do the work. So this is just is coupled to, and the underpinnings is safety. Nurses are afraid because they still are fighting this contact points where children are not mask wearing, and some of the patrons. Another component is our safety officers. When they have to engage with students or some of the public that may not want to act properly, they come into close contact, and they don't know the vax status, or if they're long haulers. So all of this is part of safety issues. When we have parents that confront, I know we have another question coming up, and they don't want to wear masks, I tell my folks, call the police, and we'll that's another issue, and the district doesn't want the publicity, but we don't want to die either. I make it very, very straight and very direct. I'll stop there.
But no, thank you. And I've got, I know I have colleagues in my department that have heard certain things that you said there. They would love to get one-on-one time with you. We're paying a lot of attention right now to school nurses, and also the fact that you represent some folks in our security services family. So you'll probably get calls from some of my colleagues. Quick follow-up question, and I'll let anybody jump in who wants to take this one, but did any of you have make an attempt or have any success with school safety committees, utilizing that as an advocacy tool? And I know I'm going a little off script here, but I'm just curious.
Related to COVID, Tim?
Yes, as related to COVID. For example, Nicole, I know that one of your advocacy responses was have to go in there with a number of MOAs. Did any of the locals want school safety committees?
No, we didn't take the route of school safety committees. We did MOAs with every local we had. In each cycle, we did an MOA for each one to talk about what reentry would look like, and then an MOA to address each of the health and safety concerns, from social distancing to masking, PPE, entry into the building, protocol, those kind of things. But none of them wanted the committees, because in their experience, the kind of dysfunction that exists with the district, once you form a committee, it sounds all well and good from the beginning. And then when everybody gets to the table, it looks good. It doesn't exactly end up a committee with all the voices that have equal representation, and you end up with an end product that is, a collaborative mind effort. It looks good. It just doesn't work out that way when you go that route. So none of my groups wanted to do that.
Okay, well, thanks. That's the kind of feedback we need to hear from the field.
Likewise, we took the direct advocacy position when districts were putting together their safety plans, planning reentry. We just went, straight to the super and whoever he assigned to it and say, look, this is not going to work. We need to do this. We need to have more PPEs. We need to have more masks. We need to have better sanitation, better custodial maintenance cycles to cleaning after class transitions, so on and so forth. I fully agree. That committee. Let me be nice. The committees are not very effective when you're dealing with major crises, and you have to understand that. So when we had issues, we had the hotline to the super, or we even went to some presidents of boards of eds, or those our friends on there, because this is a matter of life and death, and folks had to understand that. We had those competing interests of getting kids back into class, and the stressors of children not being around that's all fine and dandy. But if they're dead, they won't be able to learn. And we broke it down just very direct.
Well, thanks for that. That's I'm glad I asked that question. Thank you. All right. Next question. How have staff shortages impacted your representation? And what I'm going to be trying to get at on this is, have you opened contracts or MOUs so that districts could offer signing bonuses or hiring incentives? And why don't I'll start with Nicole on this one.
So in New Hampshire, it's unique because we force March contracts pretty quickly because of the timeline we have in New Hampshire. We essentially, when our contracts open, have from August until November to know if we have a contract or we have to declare impasse, to have enough time to do the mediation and fact-finding process so that we can have a contract ready for public vote in March. And so it's a very kind of fast-paced, intense process. And so, we're usually buried in negotiations when all those contracts are open. Currently, I have 19 contracts open, and I have 3 groups that approach me from the contracts that are not open to reopen to increase wages for support staff. I had a food service group who was unable to hire, and the superintendent's position was, look, if I can't increase their wages, I'm going to have to contract out, and it's too expensive for the district to do that, and I know you don't want me to do that. And so we talked, and we were able to reach agreement. He was going to increase everyone's wages in the unit by $2 an hour effective immediately. So we were able to do that. I've had another group for paraprofessionals and secretarial approach wanting to do sign-on bonuses. And we said, you just settled our contract without getting us the increase we were looking for. And so unless you're talking about bonuses to the entire unit, we're not interested in just providing bonuses to new hires. Because you really haven't met the threshold that we need to really provide for people in the bargaining unit. We know the cost of living is a 5.4. right now on the Boston Cambridge Index, and in some places as high as 5.9. And so unless you're going to address the entire bargaining unit, I guess you're going to struggle with short staffing, and you're going to have to come to us again, and maybe then you'll offer us what we're asking for. Other groups are considering it.
Well, thanks. And you got right to the heart of what I was trying to get at in terms of advocacy is, you leveraged the situation on behalf of our members to say, oh, well, wait a second, new hires are your problem, but existing members, that's our representation. Graylin.
Absolutely. We've used any and all opportunities. We've certainly leveraged the COVID monies to the extent where the districts would typically take the ploy of coming in a little low, particularly with incentives and bonuses. And we double, triple some of those because we had the contract, and now they are forced to come to us just because of staff shortages. Just prior to coming on, I scanned 5 of my locals of their HR sites. Everyone, they have openings in food service, bus drivers. They're paying multiple thousands of dollars sign-on bonus. They'll train drivers, pay them while they're training them to work. Safety officers are at a premium. Because we have police shortages in St. Louis. We're down 300 with the standard Metropolitan Police, and they're opening up their academies to people of interest who want to serve in that field. And we're losing safety officers to that. Food service shortages. They can't feed the kids because they don't have enough people to prepare the food. Notwithstanding some of the food, they can't get the food anymore. So. Right. It's any opportunity that we can, that COVID comes up in any discussion. We look at the COVID monies at the ESSER funds, and we're trying to leverage that. We don't want them to put all the money in buildings and grounds because that's what people are having a tendency to do. They look to update their HVAC. I can't tell you how many plans we looked at, and okay, you have HVAC, and once the contractor's gone, you have no one to maintain it. So. That includes, all of our skill trades areas. They're at a premium. I had a furnace go out personally, and they wanted to tell me 6 weeks before they could come service my furnace because all of those skilled workers, they can basically control what they can ask for. Had the conversation with the guys. He told me, "You don't pay me for what I do. You pay me for what I know how to do." And that's just like our ESPs. They know how to do it. Where can you go get a plumber and pay them $25 an hour, where the average commercial plumber is 50, 60, $75 an hour? But this is what our school districts want to do. And so if they want to play in this arena of support professionals, they're going to have to pay like the private sector, like the community standard and norm of compensation.
Yeah. Yeah, very good. Very good. Sheila, I know you're in a little different situation because you don't get to bargain much in Louisiana, but, have you been able to use staff shortages as leverage?
What's going on in most of Louisiana is because of COVID, substitute teachers are almost non-existent. So they are having to pull in paras, the teacher assistants, library monitors to man those classes when the teachers are out. That has gotten to be a headache because, of course, they can't hold that responsibility. It's illegal. So we've had to have several conversations and some grievances filed because, we can understand an emergency, but this is getting to be every day, all day. And it's especially difficult for our SPED paras because they are assigned students. So those students, and we've explained to them, okay, so these students aren't receiving the services that they need, which is going to put you in a pickle. The other thing that's going on as far as negotiating for more money, about, I'm going to say 60% of our districts are given most of them call it hero pay. It's incentive pay, but it's part of that ESSA money. So in some of the districts across the board, they're giving nice little bonuses. However, in some of the other districts, what they're doing is they're giving certified staff, like one I worked with yesterday. Certified staff gets $2,500, but you want to give the support staff $500. And all that's going to do is to put them in another tax bracket. And one of the conversations that I've had with some of the superintendents is, your certified teachers were given the